Good morning. I call the meeting to order. Since last meeting, the Secretariat has issued two information papers, CB-1225/2025-01, Referral Memorandum from the Public Complaints Office of the Legislative Council Secretariat regarding support for children and youth of single-parent families involved in marriages between Mainlanders and Hong Kong residents. Another paper is LC paper CB-1252/2025-01. It is a letter dated the 14th of February 2025 from Mr. Stanley LI requesting the panel to discuss carer-centric policies. And agenda item number 3, the extension of the District Services and Community Care Teams scheme on supporting elderly and carers to 18 districts across the territory. Dr. Tick and Mr. Stanley Li's views raised in the previous meetings were already included in this agenda item. That is about the actual effectiveness of the relevant database, that is in the Carer database. Please refer to CB-1368/2025-01 regarding the list of outstanding items for discussion. The next meeting is scheduled for the 14th of April 2025 at 10:45 in the morning. The administration proposed to discuss two items. 1. Enhancing vocational rehabilitation services for PWD persons with disabilities. And 2. Progress update on targeted poverty alleviation measures. Do members agree to discuss these two items? Let's move on to agenda number 3. Extension of the District Services and Community Care Teams scheme on supporting elderly and carers to 18 districts across the territory. Please refer to CB-1368/2025-03 and 04. We have with us today Mr. Fletch Chan, Commissioner for Rehabilitation from the Labor and Welfare Bureau. He will take us through the information paper. Members who would like to speak, please press the button to request to speak. I now invite Mr. Fletch Chan to take us through the paper. Thank you, Chairman. This paper takes members through the District Services and Community Care Team scheme on supporting elderly and carers. It provides an update on the measures taken by the administration. In 2024 March, the Bureau launched a pilot scheme. Tsuen Wan and Southern Districts are the pilot areas. It was used to identify households of singleton, doubleton elderly and carers of elderly persons as well as PWD in need. They are provided with caring and support services. The pilot scheme has been in operation for 1 year. The effect was quite good. There were a total of 36 care teams involved in the scheme. Over 7,000 households of singleton and doubleton elderly and carers of elderly persons and PWDs were contacted. There were also over 1,190 referrals related to welfare services. In view of the good effectiveness, last December, it was announced in the 2024 policy address that the scheme would be extended to all 18 districts across the territory in the second quarter of 2025. We are glad that a total of 425 care teams will also take part in this scheme. The SWD will provide training as well as support. It is hoped that services will be more targeted in April when they are launched. We have launched designated hotline for carers support 182-183, information gateway for carers, designated teams for special school leavers to help special school leavers to join the community, as well as the Carer database. These are the measures in the paper. That concludes my introduction. Thank you, Chairman. 11 members have pressed the button to request to speak. They are in order: Dr. Tan Yuehang, Ms. Lillian Kwok, Professor Chen Wen-Kwong, Ms. Connie Lam, Mr. Ambrose Lam, Mr. Bill Tang, Mr. Stanley Li, Dr. Teck Chi Yun, Dr. Frankie Ngam, Mr. Andrew Lam, and Mr. Chao Siu Chong. Each member, 4 minutes, questions and answers included. If you want the administration to reply to you, please give some time for the administration. There are quite a number of members who have pressed the button to request to speak. Let's start with the first member, Dr. Tan. Regarding the care teams, they help the administration to have a good understanding of the situation in the community. Referrals help needy people to secure support services. I have several concerns. 1. The scheme needs to be extended to all 18 districts across the territory. How much time will be needed to complete all the visits? Upon completion of the visits, do you have a record or report of all the visits conducted by care teams? Issues might not be identified in door-to-door visits. Will there be any follow-up? Will you take stock of the situation? Some elderly people may seem doing quite well, but there are potential issues such as emotional issues and so on. We may not be able to identify all issues within one single visit. Can you record the information in a systematic manner so that we can provide targeted support when necessary to all elderly persons? In other words, can we resolve the problem just with one single visit? With the information collected during one single visit, can we keep a record of such information in order to conduct further follow-ups? On a different note, some families may be facing quite minor difficulties. We may not have to refer them to social welfare organizations. Do we have a support system to provide assistance to these families? There's an increase in subsidies provided for care teams. There are calls in the community that care teams should shoulder greater responsibility. We can see relevant figures in the information paper, such as the number of households visited. Apart from these figures, do you have any other indicators showing the effectiveness of the work of the care teams? Thank you, member, for your question. After care teams conduct visits, we keep a record. After compiling these records, we will pass them on to the Social Welfare Department for follow-up. So yes, we do have a systematic record, but the record will not be very detailed. Basically, all the care team members are volunteers. We don't want them to spend so much time on these logistics work. They take notes after visits for Social Welfare Department and colleagues to conduct follow-up. When high-risk households are identified, there is subsequent follow-up or visit. After the first-time visit, we make calls to follow up on these high-risk cases. So in other words, there is consistent follow-up after the first-time visit. We may not necessarily follow these cases on to other social welfare organizations. There is follow-up after our visit. For the other questions, I will give the floor to my colleagues. Thank you. Care teams introduce social welfare services and refer cases to social welfare organizations. Care team members conduct visits, make phone calls to check on families in need. So these are not one-time visits only. There is follow-up. That is my response. Thank you. Next member, Ms. Lillian Kwok. Thank you, Chairman. First of all, I recognize the work of care teams. They work very hard. Among 7,000 visits, a total of 1,190 referrals were made. There is also the installation of Emergency Alarm System, EAS. I believe some cases are being followed up on the Social Welfare Department. These figures account for some 17% of all the cases. What about the role of the SWD? Can we enhance the role of the SWD? As you mentioned, care team members are volunteers. We need to enhance the level of participation of the SWD. SWD workers are full-time employees. They have a heavy workload. So how can we leverage technologies to provide better support to persons in need as well as to employees of the SWD? I hope the administration will think about these. These figures are quite surprising to me. In paragraph 9, there is the designated teams for special school leavers. What kind of special schools are involved? Some students may be imprisoned, they are in jail, and it takes probably 2 years to follow up on these cases. How do you follow up on these cases? Do you only focus on the seriously disabled? So apart from special schools, what about mainstream schools? We talk about inclusive education. Quite a lot of SEN students are studying in mainstream schools. Some may have visual impairment, some have hearing impairment. Recently, one hearing impairment student is admitted to the Chinese University of Hong Kong. What is the support being rendered to these students? And regarding the Carer database, are the guardians the carers? Or do you store the information of all the carers in the database? Probably there are about a dozen carers of a single person. So do you only take the guardian as a major carer? What is the definition of carer in this case? At schools, we have a system. So the school has a record of the students in need, say they have physical impairment and so on. Do you have such information in the database of the SWD? I understand there is a dialogue between schools and the administration. So can we make good use of our current database, that is SEMIS? Thank you.
Brief response, please. Thank you. I may not have enough time to answer all the questions, but the Social Welfare Department always strive to follow up on all of the cases. What the care teams want to do is not to visit these households that are targets of the Social Welfare Department. So it's the other way around. Sometimes it could be the case that these community care team and the Social Welfare Department are following up on a single case, and there could be duplication of resources. That's not ideal. Regarding the question about the Carer database, We consolidate databases of different departments, and we have been working with the Privacy Commissioner to look at how we can obtain certain exemption under the prevailing ordinance to consolidate all the databases. The Education Bureau do have live planning for mainstream school students to support them. As for support for the special school leavers, I will ask the Assistant Director to supplement. Thank you. Regarding the designated team for special school leavers, we focus on special schools with students with mental incapacities, providing a 2-year support service from 6 months before graduation to 18 months after graduation. Our team include professional social workers, occupational therapists, and other staff who work with social workers. We focus on providing appropriate services, preparing the school leavers for a smooth transition. We develop care plans and enhance their independent living skills. We already have supported 600 school leavers, and we have offered them emergency placement places. Thank you. Chairman, there are 5 students in special schools that are already in jail. If we don't help them out, then they will pose threats to the society. So I hope that you will extend the scope of your support schemes. There is a community care team that focuses on people with disability, but the people with disability should already be followed up on by the social workers. So I think that you should consolidate your resources and plug all the loopholes. Thank you. Next, Professor Chen Wing-Kwong. Thank you, Chairman. I support the government making the best use of the resources of the community care teams and support our elders and carers. I have a few questions. The government give community care teams some $800,000 to $1.2 million to the community care team, but is that enough for the community care teams to conduct their work, refer some services? Will you increase the support for care teams? Also, the care teams have to recruit volunteers to conduct visits. So I wonder if we're going to offer training to these volunteers so that they can enhance their community or communication skills and support for people in need. My second question, in terms of support for carers, I know that the government has done much, but according to the paper, the government talks about referrals all the time, and some carers told me that they don't need referrals, but actual support. Some carers said that when they are caring for elderly, they don't have time to go for follow-up consultations themselves. So I hope that the government will offer community respite services to alleviate the burden of the carers. Will you enhance community care teams' capability in offering visits to households? Third, regarding the designated hotline for carer support 182, 183, as I mentioned, some carers told me that they couldn't reach anyone. And in most of the cases, the staff manning the hotline will refer their cases to some other departments, and the carers may think that they are passing the buck. When carers are feeling down and they need support, and they call the hotline and they are referred to other service units, how would you feel if you were in their shoes? So I think that we should enhance the support for carers. Fourth, on carer database, it is said that the government is exploring the setting up of the database. I wonder if there is a timetable. If not, what is the challenges faced by the government in preparing the database? Thank you. Thank you. I believe that we can always give more resources to the care teams to offer better service, but we have to look at what we have. We do offer training for care teams so that they can carry out their works well. Second, on the point about referrals, some carers may need to go for a follow-up consultations themselves, and they aren't able to do so because they have to care for their elders. We do have respite services that they can be referred to so that they can run errands. Regarding the hotline 182 183, during the initial stage of the establishment of the hotline, there were problems, and we tried to call the hotline ourselves. And we do conduct covert operations to assess the service level of the support hotline. And actually, the hotline was picked up in a few seconds usually. And the staff would refer the carers to the service that they need, including respite services. And they introduce the service that they need to the carers and do service matching proactively. The social workers manning the hotline are caring and they're friendly. There could be problems during the initial stage of the establishment of the hotline, but things have improved recently. What about the carer database? Thank you. The biggest challenge that we face when we prepare the database is that when different departments collect their own information, they collect it for different purposes. Say, for example, the information collected by the hospital authority is different from that of the housing department or the education bureau. With the personal data privacy ordinance, we need to comply with the regulations and provisions when we try to consolidate all the databases. And we've been working with the Privacy Commissioner to see if we can leverage on the exemptions under the existing ordinance to smoothen our work. We're looking into how we can fulfill all the requirements. This is the challenge that we face. Say, after the HA has collected the data, can they refer or send the data to the social welfare department? When we collect new data, we can do that, perhaps, but we have to be fair. We should not ask the data provider to allow us to use their data for all kinds of purposes. Some of the data has been collected, and we cannot solve it with the proposal as suggested by the member. Next, Ms. Lam So-wai. Thank you. This district services and community care team scheme on supporting the elders and carers were implemented last year, and now it's going to be extended to all 18 districts. In the next quarter this year, you will extend the scheme, but the community care team of 2-year term will end their service in September 2025. We have dedicated so much resources into training community care team members on mental health, on first aid. How do we transition from one term of the schemes to another? What challenges have we faced when we train the community care team members? Because the members could be retirees, they may not come from a high education background. Should we improve the teaching materials? I'd like to follow up on mental health first aid program. Can we actually implement it? After the care team members have taken the courses, do we have any figures on the effectiveness of the program? Because the care team members of all 18 districts actually took the course. I wonder if they've put what they learned into use. On Carer database, this is to detect high-risk cases and to offer early intervention support. You said that you are working things out with the privacy commissioner, but for Lands Department, Housing Department, HAD, and the district office, can we establish a mechanism for referrals? And as the next stage, we can look at how we can refer the cases to nonprofit making organizations. Because otherwise, it would be a waste of resources. Thank you. Commissioner. Thank you, Ms. Lam, for the question. Regarding the development of the care teams after September 2025, we're looking into it. The care team members are dedicated volunteers. I believe that they will continue to serve the community after they have left the teams. Our training is a continuous effort. I will ask the Assistant Director to elaborate. On the point about mental health first aid, I think that initiative under the Health Bureau, I don't have the relevant data at hand. I will ask them for it and reply you after the meeting. You ask if we can establish an interdepartmental data sharing mechanism. The Personal Data Privacy Ordinance restricts the purpose of data collection of the government departments. If we want to use the data for other purposes, we need to follow the procedures as set out under the Personal Data Privacy Ordinance. The Social Welfare Department we have a list of PICs, personal information collection. We set out in the agreement that we may use the data collected to NGOs or HAs so that we can offer other kinds of services to the people in need and their family members. Thank you. Chairman, I'd like to follow on one point that the Commissioner has not addressed. What challenges have you faced when you train the community care teams? The Assistant Director will take the question. Thank you. When we rolled out the pilot scheme in Tsuen Wan and Southern Districts, we did face some challenges, but those challenges have been overcome. Say, for example, we need to make sure that the care teams are aware of the needs of the people that we want to help. We realized that we did need to offer training to the care teams to enhance their understanding. Currently, the social welfare organizations are providing professional services, and the care team members are caring people in the districts, and they focus on caring for their neighbors, and they actually meet the service targets in their day-to-day life. So offering care is their strengths. Just now, Professor Chen Wing-Kon asked why there are so many referrals, and that's exactly the reason why. When the care teams have identified high-risk cases, they will refer them to social welfare organizations. The social welfare organizations offer professional services, and the care teams are the ones who make the referrals very often. And this is how they divide their works. And this is how we can overcome our challenges. And in this case, the care teams don't have to shoulder so much responsibility. They can work with each other. And that's the experience that we've learned when we implemented the pilot scheme. In these 2 districts, we have organized 8 training courses, and after receiving their feedback, we have offered enhanced training to the care team members, and now the division of work have been more smooth.
Thank you, Chairman. Next member, Mr. Ambrose Lam. Thank you, Chairman. Members and the administrations touched upon personal privacy and the healthcare system. I understand medical information or healthcare personal information is a matter of privacy. What about information that is less sensitive? At the panel on housing last Friday, the Housing Authority mentioned data in relation to the number of elderly households. Have the care teams conducted any study on elderly households living in public housing estates? I believe these figures are easy to collect and they are not as sensitive. Organizations provide meal delivery services to elderly households. I'd like to know, apart from referral services, do social welfare organizations and care teams interact well? Isn't there any overlapping of resources among these 2 bodies? Can you tell us whether there are overlapped KPIs? Well, we have aggregate figures, but what we want to do is to collect information from another perspective. Say, which households are singleton elderly or doubleton elderly? These figures concern matters of privacy. We're working on resolving this problem together with the Housing Department. After removing this obstacle, then we'll find the services. We may be able to provide even more targeted services. We want to have such information in order to improve our services. Assistant Commissioner, regarding collaboration between care teams and NGOs, in our pilot scheme, care teams in social service units, say those providing elderly services or family services, or even those about mental health or social protection, there are matching services within a smaller district. In other words, we only need to identify one single social welfare unit to provide different kinds of services. There are visits in which households have a good understanding of social welfare services, group activities provided by different social welfare organizations. So care teams have a good understanding of different services. Care teams provide day-to-day care and support. This is different from seeking help from social welfare organizations. There is no overlapping of resources. They do complement each other. Thank you. Members asked about data interoperability. Probably we can think more about this. Well, we shouldn't pass the buck to the office of the PCP. Some figures are less sensitive. Say some members only asked about the age of households or the elderly persons. Well, Chairman, can I supplement? Well, we aren't passing the buck to the office of the PCPD. We do want to comply with all the provisions under the PDPO. The office of the PCPD has been helping us a lot. There are existing exemptions under the ordinance. They gave us suggestions on making use of existing exemptions, so we aren't passing the buck to the office of the PCPD. Well, you need to draw up a timetable. We have been discussing this issue for quite a long time. We've been asking for data sharing or data interoperability. So you need to set a deadline. Thank you. Next member, Mr. Bill Tang. Thank you, Chairman. I'm confident in the Commissioner for Rehabilitation. I understand he wants to achieve breakthroughs. I hope things will move faster. Care teams provide caring services to the elderly. Not just care teams, actually all members of the public also care about elderly people in Hong Kong. But it's a matter of accessibility. Last November, my office wrote a letter to the Housing Department. I requested going to several housing estates in Kwun Tong. They didn't reply to us. They didn't give us the green light. Well, they said that it'd be difficult for them to prevent any door-to-door visits to be conducted by the FTU. All members of care teams are volunteers. They aren't paid. Volunteers need to identify elderly people in Hong Kong. There are a total of 1.7 million elderly people in Hong Kong. But then when we need to conduct door-to-door visits to identify these elderly people. Last November, together with the FTU Kwun Tong team, we selected 7 blocks. Only 38% of the households responded to us. Only a few of them opened the door. So how can we actually show care to elderly people when we couldn't identify these people? They may be active elderly people in the community, and then we may care about them first. In other words, we cannot achieve our policy aim of identifying hidden elderly people. The list should be provided by the Social Welfare Department of the government. That is the main point. Their disability allowance, fruit money, old age living allowance. A lot of elderly people are receiving these allowances. We already have a large database. But the form doesn't require them to declare whether they are singleton elderly people or whether they are PWDs. You already have a form. You need to ask them to provide such information. There are Social Welfare Department service recipients, so it is assumed that you receive Social Welfare Department services at the same time. If you do not wish to accept such services, you can opt out. There should be an opt-out mechanism. We shouldn't fight for data sharing with the hospital authority no matter what. We need to fare better with the database of the Social Welfare Department. We need to improve the form. With an improved form, things will have improved dramatically. Thank you. We're working towards this direction as well. Under PICS, personal information collection statement, in all the forms of social welfare services, we require the provision of personal particulars. To a certain degree, this is akin to the opt-out arrangement mentioned by Mr. Bill Tang. Of course, we can do some more. Then we can collect more information about the households, such as the old age living allowance. 700,000 to 700,000 are receiving allowance. This is the largest database we already have. You just need to tweak the system. Then we'll have a large database. Thank you. Next member. Well, I'd like to supplement as well. Assistant Commissioner, please. In the pilot scheme spanning the two areas, that is Tsuen Wan and Southern Districts, NGOs and the SWD conduct activities in the districts. There are also street stalls or booths to enhance publicity. Then we can be in touch with more residents in the districts. Whether they are singleton elderly people or doubleton elderly people, they go out to buy food, then we can be in touch with these elderly people. When we obtain consent, then we may make visits to these elderly people. Well, these are too conservative, I'm afraid. Well, Mr. Biu Tang was talking about hidden elderly people, which means the elderly people whom you cannot get a hold of. Thank you. Next member, Mr. Stanley Li. Thank you. In 2024 policy address, the chief executive mentioned that we need to have a database for elderly people and carers. I thank the administration for taking on board my view, but how can we actually achieve this? I'd like to know whether this database has been activated. Do you have any figures? Can you provide me with any figures that you have? Well, it is not in operation yet. We are still preparing for it. There are two major fronts of work. One, in relation to privacy. I have already touched upon it. We also need to solve technical difficulties, say the technical structure of the database or the system compatibility and so on. Since databases are set up by different organizations at the same time, well, allowances are issued by the administration. Some 10,000 carers are applying for carer subsidies or carer allowances. Well, you may include these 10,000 people in the database. They are receiving carer allowance of about $3,000. Regarding the speed, well, I'm kind of concerned about the speed of setting up the database. Having a database is instrumental in supporting carers in Hong Kong. There are about 400,000 to 500,000 carers in Hong Kong. They provide one-to-one matching services. But our database isn't comprehensive enough. We need to work harder. With a database, we can provide better support to carers. This February in Tsuen Wan, a case happened. There was a tragedy in February. A 44-year-old mentally disabled stayed behind the body of his parent for a long time. This is a tragedy of the mentally disabled caring for the elderly. About 3 to 4 referrals per day. In the Shatin district, say about 700,000 population, or in Changkwano, about 500,000 population. Can the SWD cope with such a large population? Thank you.
Commissioner, I completely agree with what Mr. Stanley Li said. We will definitely consolidate different databases. And we do have information available, but the problem is how we can consolidate it. We are going to use the information that we collect from carer allowance scheme. The carer database is to consolidate different databases. Sorry, I still have 20 seconds left. What about the manpower of the Social Welfare Department if we are to extend the pilot scheme to other districts? Manpower would definitely be an issue. We're talking about manpower of our department and also that of the social welfare organizations. We'll look into how we can, say, streamline the work process to enhance the efficiency. But the limited resources do pose constraints. But first of all, we look at the demand first to see how we can come up with a supply of manpower. Thank you. Next, Dr. Teck Chi Yun. Thank you. I hope that there will be a list of carers, especially those taking care of high-risk elders or persons with disabilities. We are very anxious. But after listening to the administration's response, it seems that we are not making any progress. We do have abundant of information at hand. I believe that you do have information on high-risk carers. I don't understand why you're still talking about technical issues. As what the chairman said, I hope that you will speed things up. Please give us a timetable. We already have so many databases. I think that you need to tell the society about your timetable. Second, say if we have 200,000 carers in Hong Kong, how can we support them? We're talking about high-risk cases. We need to have a support network. What about the support services that we're going to offer these carers? The reason why I asked this question is that, well, we have this hotline, we have community care teams, we do have an information gateway. All these are to identify those in need, but we don't have any support services. When elderly call the 182, 183, they may give them another phone number to call to receive services. What if the elderly is being asked to go for residential care homes and there is a long waiting list? Then they don't really get any support. So when will you be able to come up with a list of carers? Second, are you thinking about the support services that we offer to this group of carers? Thank you, Commissioner. Thank you. I cannot give you a timetable as of right now. My apologies. I don't want to give you any empty promise. Second, I think that first of all, we have to look at our level of demand. Before we see what kind of service that we need to offer. So I think that we have to deal with the demand side factors first. As for what kind of service the elderly or people with disabilities need, well, say for example, the community care teams, when they identify high-risk or hidden cases, they can refer them to the social welfare department. We do have elderly daycare centers. We can refer them to units for the installation of EAS, the emergency alarm system. The units offering the EAS also make concern calls to high-risk families to look at what they need. Thank you. Chairman, I am very disappointed. You said that you don't have a well-thought-out timetable. It seems that you have not thought about it at all. I think that you need to at least give us a rough timetable Are we talking about 6 months, 3 years? You tell me today that you don't know what the high-risk cases demand is, and you say that you need to come up with the service after you have get hold of the demand level. Commissioner, I don't want to give this wrong impression that technical issues are easy to solve. They are complicated things that we need to look into. Second, different high-risk carers need different services. Some of them don't have specific demand regularly, but when the elderly has to be hospitalized, then they would need emergency services. So we need to have a database first. Say, for example, when the hospital authority identify a high-risk carer being hospitalized, then we can be alerted that there is a person that need to be cared for in a home that is unattended. So I think that we need to be aware of the complexity of this database. Thank you. Next, Ms. Dr. Ng Yu. Thank you. I have to declare interest. I'm a member of the Kwun Tong Community Care Team, although I don't have any pecuniary interest in it. A lot of members talked about a list of carers. What I want to say is that regardless of how long the list of carer is, there is always someone who is not included. And this is a group of people that we need to identify. We have 400 care teams. They are helping the government to come up with a list and give them to the Social Welfare Department so that we can offer appropriate support. I think that the members need to have confidence in the network and the strengths of our community care teams. The care teams are here to support the government's efforts in district governance. I'd like to talk about the emergency alarm systems. CSSA recipients can install EAS free of charge. People living in the public rental housing or housing offered by this housing society have a 2-year subsidy for the installation and use of EAS. For elderly people living in PRH or housing society units, they may choose not to install it because they only receive 2-year subsidy. Some of them only realize that they have to pay upon the expiry of the 2-year subsidy. And some of them may argue with the EAS company. So I hope that the community care team will identify elders or persons in need and refer them to the Social Welfare Department. And then the department could make an assessment on the income or asset level of the elders or persons with disabilities. I think that we need to offer elders and persons with disabilities that don't have the means use installation of EAS free of charge. Thank you, Commissioner. Or Assistant Director. Please turn on her microphone. Thank you. The member is well aware of the situation. The CSSA recipients are able to use the EAS free of charge. For people living in housing society units, they are subsidized as well. For people living in PRH, they receive a subsidy of $2,500. The subsidy offered under the community care team pilot scheme is to plug all the loopholes and to, well, contractors of EAS is different every year. We do have different directions of subsidy under different schemes. For community care team schemes, we offer subsidy to elderly aged over 65 or household with persons with disabilities who are not eligible for other schemes. As long as they have an income lower than the old age living allowance, then they can receive the subsidy. Chairman, I'd like to ask about the amount of subsidy and the length of it. Is it 2 years? We offer 1 year subsidy. They can use the EAS free of charge for a year, and we have to look into it after a year time. And that's the resources problem. Thank you. Next, Mr. Andrew Lam. I'd like to talk about data. I'm not just concerned about database of carers or elderly persons. I'm concerned about the overall use of data. I know that you are perhaps working towards the right direction, but my impression is that you're trying to take things slow and you're being cautious, but I don't see a strategy or a framework on establishing a centralized database through community care teams or social welfare organizations. How can we leverage on their strengths or network so that we can collect a comprehensive set of data? Does the government have a comprehensive framework to include all of the data? I understand that we have a lot of regulations under the Personal Data Privacy Ordinance, but what is our next step? I don't want to repeat what other members have said. When can we have a database? For the community care teams or social welfare organizations to enhance their service. Let me give you an example. Some 10 years ago, I helped the government in promoting waste separation at schools. The teachers and the students worked very hard to separate waste, but then eventually the 3 colored bins were poured into a single rubbish bin. The community care team's been working very hard, but it turned out that they don't have the information that they need. And there is no KPIs on referral services. The commissioner said that each case is different. It may not be fair for us to set a KPI, but in the mainland, they have a KPI on the response time of each and every department. But having this figure or data is easier for the government to follow up on these cases. It's important for us to have an integrated database. I am looking forward to a strategy or framework. I hope that this panel will ask the government to give us the strategy that they have, instead of giving us an initiative here or there. To be honest, I am impatient. Thank you.
Commissioner. Thank you, Chairman. Thank you, Mr. Andrew Lam, for your questions. Let me talk about our major direction in relation to the Carer database. We aim to put all the information about carers and those being cared for into the database. We want to sort out the relationships between carers and those being cared for. Allowances are one of the sources. The housing department can also provide information that may be of help to us. When care teams conduct visits, they will also be able to identify the relationships between carers and persons being cared for, say singleton elderly people, doubleton elderly people, or the elderly taking care of the disabled. There are issues relating to privacy. Say the information of the housing department isn't supposed to be used in this manner. With the database, we will have an idea of what kind of services carers and persons being cared for are receiving. Or for those who aren't receiving any of such services, we may be able to recommend appropriate services to these people. But the crux of the matter is that we need to sort out the major matters before we can tell members what we can actually do and when we can do it. Thank you. Next member, Mr. Chao Siu Chung. In less than 1 year, care teams got in touch with 10,000 households in the 2 districts. Over 1,190 referrals were made. The pilot scheme was quite effective, so I support the extension of the pilot scheme to all 18 districts across the city. The regularization of care team allowances was announced. So when the scheme is expanded to all 18 districts in Hong Kong, will the scheme still provide allowances ranging between 160,000 and 240,000 like what we have seen in these 2 pilot districts? Is there any room for adjustment? Another question is about the carer database. Well, you don't have to answer me. Your answers are disappointing. I fail to see any timetable with your answers. I don't know when the carer database will come on stream. This is a huge letdown. The SWD has launched a scheme helping the carers. Training is provided to carers. So the scheme Care for Carers, what is the implementation progress? How many people have been trained? How many elderly people have been identified that require help? Have you taken stock of the scheme? Will you take stock of the scheme? Thank you. I'd like to give the floor to the Assistant Director to talk about the Support for Carers project. Thank you. The project was launched in 2013, and we have added PWDs as well, hence the name Support for Carers project. Right now, 300 property management companies have participated in this project. A total of 2,500 buildings are involved. Frontline property management practitioners have received training. They total 6,500. The SWD deployed resources to provide training for a total of 3 years. It's been 1 year or so far. will take stock of the situation. For PWD, there are district support centers for PWDs, and there are also support centers for elderly people in the community. For those that have been identified, they will receive services in the district support center for PWDs and for elderly people. Well, Assistant Director, do you have any figures? At present, we don't have any figures. This is not included in the agenda item today. Probably you can supplement us with figures after the meeting. Thank you. Ms. Dorian Kong. Thank you, Chairman. Well, I believe all members share the same feeling. I'm not denying the function of care teams. For 452 teams, care teams, I'm not sure about the positioning and the strategies of care teams. They've used a lot of government resources, however. In relation to organization, strategies, and positioning, do you have any documents to provide to us? Well, I hope they will provide us with documents. We understand care teams do have their functions, but it is not possible that we have no idea whatsoever about the organization's strategies of care teams. Right now, there are 36 care teams, and referrals were mentioned yet again in the information paper. With 452 care teams, there will be a lot of bottlenecks in social welfare organizations. Mainly, care teams are responsible for referrals. So how are you going to work around this problem? We talk about using big data and technologies to monitor care teams. You're going to have 400 or so care teams. So who will be monitoring the operation of care teams? Say how many cases have been referred. When they report the number of referrals, you believe they have already done their jobs. Now that you have set up a lot of teams, I need to ask about positioning, but why? That is exactly because you have mentioned that in the information paper. Does the office of the PCPD have the power to inspect care teams under the PDPO? Does the office of the PCPD have any power to inspect care teams? What about Office of the Ombudsman, Anti-Corruption Ordinance? These, well, I mean, although they are volunteers, still, this is public work. Do they enjoy the same level of protection? Well, I'd like to know more about the positioning of care teams under the PDPO, Office of the Ombudsman, as well as the Anti-Corruption Ordinance or Prevention of Bribery Ordinance. The PDPO is applicable to both the administration, government organizations, as well as non-government organizations. For information collected by care teams, consent of households needs to be obtained before it could be referred to the SWD. Likewise, the Prevention of Bribery Ordinance has the same situation as well. Regarding the Office of the Ombudsman, we may have to seek legal advice. The SWD is implementing this scheme, and care teams are agents. The Office of the Ombudsman can directly monitor the SWD. So to a certain degree, care teams are subject to supervision or monitoring by the Office of the Ombudsman. Well, I have reservations. I hope they will go back and study these 3 ordinances. What entity are care teams? Why are they subject to regulation and supervision? Under what circumstances will they be subject to supervision and regulation? I need a written reply from the administration. What is the principle? Will the agents be subject to regulation and supervision? Well, the administration can go back to study this issue and provide us with a written response. Thank you. Next member, Mr. Kenneth Leung. Like many members, I'd like to know more about the effect after the extension of the district services and community care teams. I haven't heard any quite systematic reply from the administration. After cases are identified, how will the administration follow up on the cases effectively? I hope the administration will fare better in this regard. I have some minor issues to follow up on. 1. There are hidden elderly people in the community. When doors are not answered, how will care teams handle the situation? What will they do? There are 2 districts under the pilot scheme. Some work has been done. Will we provide best practice or new materials to train new participants? As member mentioned, care teams are highly capable. They come from different backgrounds. They can provide support services, not just making referrals. Can you provide value-added services with care teams? Commissioner, thank you, Mr. Kenneth Leung. The first question of Mr. Leung reminded me of my answer to Mr. Ing Kong's first question. The scheme was piloted in 2 districts, and then it will be further expanded to all 18 districts. We have referral cases from these 2 districts, and we provide similar support services to all referral cases. Well, I'm not talking about scalability. I'm talking about when doors are not answered. So what will care teams do? In Tsuen Wan and Southern districts, the scheme was piloted in March 2024. We have accumulated implementation experience with the pilot scheme. Some households or families didn't answer the door. Care teams are volunteers of residents living in the same districts, so they will keep an eye on the situation. Say they will observe the living pattern of these households. I believe they know how to handle the situation. Apart from introducing social welfare services, they will take households to district centers nearby. Volunteers will chat with them. These have led to a lot of successful referrals. In these 2 districts, there are a total of 1,190 referrals, so we will try our level best to get a hold of different hidden elderly people. When social welfare workers knock on the doors, they didn't answer the door. Well, actually, social welfare workers can be in touch with these hidden elderly people as well, not just by care teams, but as I mentioned, care team members come from different backgrounds. Is it possible to provide different value-added services? In the past, not just care teams, there are similar demands in society as well. We take into account the strengths of different care team members. We don't impose requirements on all care teams. When care teams think that they can do more to help the needy in the community, we can provide facilitation, and different social welfare organizations will also work together. Thank you.
We've been discussing this item for quite some time, and we have overrun. I think that we should move on. The next item, progress of the incentive scheme to encourage provision of residential care home for the elderly premises in new private developments. Please refer to paper number CB bracket 1368/2025 bracket 05 and bracket 06. Would the administration please come in? We have from the Labor and Welfare Bureau, Mr. Chong Wing-Won, Deputy Secretary. He will brief us on the paper. Would members who'd like to put questions, please press the button now. Mr. Zhang, please brief us on the paper. Thank you. Chairman, members, we are here to report or brief members on the implementation progress of the incentive scheme to encourage provision of residential care homes for the elderly premises in new private developments. We want to leverage on market forces to develop quality residential care homes for elderly premises to meet the community diverse demand for RCHE places. The government launched the incentive scheme in August 2003. Under the scheme, concessions may be granted to exempt eligible RCHE premises from payment of land premium in respect of land transactions for residential or commercial developments on condition that they comply with certain lease conditions and obtain support from the Social Welfare Department. In order to make sure that the policy goals of the incentive scheme is met, the Social Welfare Department looked into various factors, including the demand for RCHE services in the district, accessibility of the site, and whether the project concerned can meet the criteria for obtaining an RCHE license, etc., when they're considering giving support to the provision of RCHE premises in a particular development. It is also stated in the lease conditions that the RCHE premises must comply with the requirements imposed by the Social Welfare Department and the relevant ordinances, bylaws, or regulations, and that throughout the term of the land lease, the RCHE must be operated to the satisfaction of SWD. To provide more incentives for developers to provide RCHE premises in new private developments, in June 2023, the government launched enhancement measures, including relaxing the number and the maximum total GFA of RCHE premises eligible for premium payment exemption. From currently one RCHE premises not exceeding 5,400 square meters to more than one RCHE premises with maximum total GFA of 12,000 square meters or 10% of the total GFA permissible under lease, whichever is higher or greater. The second enhancement measure is that when calculating the total GFA of the entire project, the total GFA of the eligible RCHE premises in the private development projects will be exempted from being counted in the total GFA of the entire project under lease. The government will review the effectiveness of the enhanced measures after piloting for 3 years. Before the launch of the enhancement measures, the land departments received 8 applications, out of which 2 projects have already completed. The remaining 6 applications are pure RCHE premises projects. The lands department has executed the land leases for 2 of the applications. 3 of the applications are under processing, and 1 application could not be further processed due to a lawsuit over the title of the site. After implementation of the enhancement measures, the number of applications made under the incentive scheme has notably increased. Since June 2023, the Lands Department received 10 applications. 6 of them are mixed-use development projects involving the provision of RCHG premises, residential flats, and/or other facilities. 3 are pure RCHG premises project, and the remaining 1 has been withdrawn by the applicant. So much for my presentation. I welcome questions from members. Thank you. There are 7 members who have pressed the button. I will read out their names. There are Mr. Benson Look, Mr. Andrew Lam, Professor Chong Wing Kong, Mr. Chao Su Chong, Ms. Doreen Kong, Ms. Judy Chan, and Reverend Peter Kun, myself, that is. Each member will have 5 minutes, including question and answer. Mr. Benson Look. Thank you, Chairman. When we try to solve different social issues, we need to collaborate with the business and the market. It's important that we leverage on their forces. We are trying to encourage the provision of RCHE in new developments. It seems that the effectiveness is not as bad. There are 2 projects that have been completed, 6 underway. The government is providing policy support, and the business, private market is funding the provision of the RCHE. This is a new model for us to solve the social issues that we have. Well, on this measure of exempting GFA from calculation, I noticed that the Development Bureau is using the same approach. They are exempting the GFA of car parks from the total GFA. There is a 100% exemption, and they're looking into it. From the perspective of the business sector, we think that it's easier for us to sell parking spaces than residential units. It would be the best if we can include more infrastructures that can be exempted from the calculation of total GFA. How can you compete with other departments or bureaus? We don't have enough social welfare facilities. This has been a long-standing issue. Of course, we're talking about RCHE here. If we all remember, 5 years ago, the government adopted another approach. They set aside $20 billion for social welfare department to purchase properties for social welfare purposes. But the effectiveness of this approach is not as good because there were reports saying that the $20 billion, only $240 million been spent, and only 2 properties have been purchased by the Social Welfare Department. There is still $19.7 billion that has been left unspent. The social welfare organizations have to cut their expenditure by a certain percentage in the coming years. We have a tight budget. I can predict what the department is going to answer. They're going to say that we have dedicated funding for dedicated projects, but I think that we have to adopt innovative approach by reallocating the resources. Thank you. Who will take the question? Deputy Secretary. Thank you. Regarding competition with other departments or bureaus, well, different departments and bureaus have their own policy goals, and they adopt different policy tools to offer incentives for the trade. For Labor and Welfare Bureau, we want to leverage on this policy to encourage the market to provide more RCHEs. We exempt the calculation of GFA, and we also exempt the payment of land premium for the provision of RCHEs. We think that is effective, and after launching the enhancement measures, we have received more applications. So this is a good thing for the overall market. Government, as a facilitator, we leave it to the developers to decide whether they will develop RCHE in their developments. The Labor and Welfare Bureau will offer more information in due course regarding the progress of the incentive scheme and the $20 billion project. Because that project covers a wide range of measures, the facilities covered is more than just RCHEs. That's not under my purview, so I suggest the Bureau coming to the panel to report on its progress on another occasion. Next, Mr. Andrew Lam. Thank you. There were 2 points in the Deputy Secretary's reply that I'd like to talk about. In 2003, the government launched the incentive scheme by the Labor and Welfare Bureau. I support the policy goals. The government said that they've seen results. From 2003 to the launching of the enhancement measures, we have only received 8 applications, 2 projects being completed. This is not result. I think that the numbers show that this policies failed. And this brings me to my second point. The government said that they adopt a market-led approach. The reason why we roll out this incentive scheme is to encourage the market to help us in providing RCHE. 20 years have passed. We've only seen a few applications and only 2 projects have been completed. And only after 20 years have passed since the launch did you launch the enhancement measures. The problem is with market-led approach that you adopt. We want to offer more RCHE places, and the scheme has failed. I think that we have to review it to see how we can further encourage the market to offer more places. This is our goal. From 2003 to 2023, only 350 places been provided. After the launch of the enhancement measures, we've received 10 new applications. Even when all the projects are being completed, we only have some 3,000 places. Is this the policy goal of the government by having this incentive scheme? Apart from offering incentives, do the Labor and Welfare Bureau or the Social Welfare Department have any analysis on where the problems lie? Did you intervene in helping the developers to solve their issues so that we can actually achieve all the goals that we have and so that we can have all the places that we intend to have?
Thank you, Chairman. Thank you, Mr. Andrew Lam, for your questions. First, on the effectiveness of the scheme. After enhancements, the effect was quite significant. There were more applicants. We found that the effectiveness of the scheme wasn't quite effective. That's exactly why we introduced enhancement measures in 2023. We have 3 departments, 1 planning department, land department, as well as the social welfare department. we make sure the OZP requirements are met. There are also facilitation measures rolled out by the Lands Department. It sort of provides a one-stop shop to solve all the questions or all the problems of the applicants. Take the second case as an example. The application was submitted in April and it was approved in September. It was quite efficient. All cases have different issues, but then departments handled all the applications expeditiously. Thank you. Well, you are saying that different departments have their functions and responsibilities. But the point is whether the Bureau has identified the problem. The Bureau involved. Well, I mean, the Bureau should provide assistance to different departments. You shouldn't take stock of the situation only after 2 decades. Next member, Professor Chen Wen-kwong. Thank you, Chairman. To encourage the provision of residential care homes for the elderly premises in new private developments, I'd like to view my concerns. They are similar to Mr. Andrew Lam's. It seems new private developers aren't that interested in it. Only 8 applications were received. Despite enhancement measures in June 2023, after the provision of more incentive, only a total of 10 applications have been received since. Does the administration know the reasons for developers not to take part in it? From approval to construction to operation and commission, it spans a long period of time. All stages aren't taken forward expeditiously. What is the time of approval for each stage? Will the administration consider streamlining administrative procedures to help developers to make applications? Thank you. DS. Thank you, Chairman. Just now I said that the administration incentivize private developers to provide residential care homes for the elderly. We understood that we lacked incentives back then. That's exactly why in 2023 we provided even more incentives. We granted exemptions to the gross floor area as well. In a span of 2 years, we saw an increase in the number of applications. This is a market-oriented approach. Are there any business models with greater flexibility or greater profits? Has the land use potential been considered by developers? We leave the decision to developers. Let's take a look at the 16 cases. Some members may think that they span a long period of time. Some cases haven't been commissioned yet. 3 of the 16 cases were submitted before 2000, whereas the remaining were submitted after 2000. One case 2008, one case 2012, and the other 2018. whereas the remaining were submitted after 2020. Some have already received support from the SWD, some are still pending approval by departments. The difficulties of different projects vary. For those who have been involved in development, they will know that there are issues in relation to leases, traffic impact study, and so on. On streamlining administrative procedures, the planning department has done a lot on this front. Said 4 months have been reduced as a result of the streamlined procedures. There are also facilitation measures to take forward the projects more expeditiously. That is my response. Thank you. Thank you, Chairman. Well, for a project with this effect after 20 years, well, will you say that this is an unsuccessful scheme? Well, we'll keep enhancing this scheme. 3 years later, that is 3 years after 2023, in 2026, we'll take stock of the scheme to see whether we'll continue to implement it or to see how we can strive for improvements. Thank you. Next member, Mr. Chao Siu-chung. Thank you. We have an aging population. Of course, I support all measures that provide more residential care homes for the elderly. After enhancement in 2023, 10 more applications have been seen. Comparing with the past 20 years, there were only 7 cases. So I believe there's a marked improvement in incentives. However, the project is being taken forward at a snail's pace. Only 300 or so services that can be provided. This is indeed quite slow. You need to improve the situation. In 2023, while we were discussing the enhanced scheme, the administration said that different departments will handle applications in tandem. This response was provided by the Bureau. Upon receipt of applications, different departments will handle the applications together. I'd like to know whether this is being implemented in different departments. For Kimberley Road in Kowloon Tong and Martin Pop Project in Yuen Long, the TPB Town Planning Board approved in June 2022 to relax the building height. The Social Welfare Department also supported this project. But it is said that the Land Department is discussing with the project proponent. It's been 2 to 3 years. If procedures are really taken forward in tandem, does it still take so long? Is there any room for enhancing speed and efficiency? When this project goes to the Land Department, there will still be other procedures at the building department, for example, procedures about plans or building plans. So I'd like to see if there is any further room to enhance the speed and efficiency. DS. Thank you. Members may have the impression that developments are being taken forward quite slowly. Apart from approval by departments, developers will decide when to build the project. When developers don't provide all information necessary, and when we request modifying the project, the housing department will approve the building plan, after which construction will take place. Developers can decide when to submit the application, when to apply for licenses, and when to start the projects. In some cases, the design of the projects isn't modified for just once. Then developers will have to submit the application once again. These will make the application process longer. This happened to a few cases. It is not the case that the buildings will be constructed right after application. A building plan was submitted to the building department in 2008. In 2012, the land lease was approved. Why? It was exactly because between these 2 years, a lot of changes had taken place. A lot of the land lease had been modified for many times. Well, excuse me, Chairman, I'd like to interject. Well, I don't want to talk about developers. Let's not talk about developers. I'd like to talk about the administration. I mean, are the procedures being taken forward in tandem? If they were, why would it still take 2 years to handle an application? Well, based on what I know, these have been implemented, but I'll give the floor to the department to answer your questions. I'll give the floor to the planning department and then to the lands department. Thank you. Once we receive planning applications, we encourage applicants to have a pre-application consultation session with us. This is submitted to the Lands Department and the SWD for approval. When we identify any problem, we'll inform the applicant as soon as possible. And I'll give the floor to the Lands Department as well. Thank you, member, for your question. Approval procedures to be taken forward in tandem. Well, as we mentioned, when care teams receive the cases will be handled in tandem by different departments. Regarding the project of Kimberley Road, in 2023, there was an enhanced case. So in January 2024, the applicant submitted an enhanced application. The project was about to be signed for confirmation. We believe if there are no further requirements by the applicant, the project will be signed within 3 months. I'll draw a line here. Mr. Hong Kong, thank you.
Chairman, I think that this policy is well intended. It is to encourage provision of RCHE premises. But it seems that it's not well implemented. And there is a lack of review of the scheme. As a result, the result is not as satisfactory. The reason why developers don't find the scheme appealing could be multifaceted. Now, the RCHE premises are set out in the land lease. This makes it inflexible for the developers. Now, if the site is vacant for 12 months, then the developers will be deemed to have violated the land lease, and the developers have to purchase the entire lot. As you can see, the lots are not small. You allow the developers to build more than one RCHE premises, but there are constraints. When developers join the scheme, they are well-intended, they want to contribute to the society, but once the land lease is amended, it's forever, and it limits the development. In 2026, you are going to put an end to the enhancement measures. Will you be able to further relax the scheme? You can give them a short-term waiver. Say, allow the developers to operate the RCHE premises for just 10 years, so that developers can have their site restricted for only 10 years. As we all know, the environment changes. When retiring in the Greater Bay Area becomes a trend, then what should the developers do? Should they rezone their site? It's difficult for the developers to change or amend the land leases. Is there ways for us to make the scheme more flexible and make it more appealing? Second, in 2026 December, the enhancement measures will end. What is the way forward? There's a year before the review. Will you change the scheme significantly from the original approach in 2003? Thank you. Deputy Secretary. Ms. Khan asked if we should give the developers a short-term waiver instead of amending the land lease. Well, this scheme applies to new development projects. We're talking about new premises. For short-term waivers, it applies to sites with existing uses. There is a difference in the nature. I will ask the Lands Department to supplement. Thank you. I agree with what the Deputy Secretary said. What I want to say is that we have to think outside the box. We need to be innovative. Have you asked the developers if this is a main hurdle? If that is, you should relax it. We should be able to change our rules. What I said was just a suggestion for reference. The member is asking if the barriers have been relaxed. Is the incentive enough for the developers? Because with so many constraints, the developers will become hesitant in joining the scheme. Any reply? Understood, Chairman. Let me explain it further. Waiver only applies to existing sites. If you want to change the use, you have to apply for a waiver. For this scheme, we're talking about new development sites. If the developers want to discontinue the RCHE premises and use the site for other purposes, we do have, we don't have a mechanism to deal with that yet, and I don't have a crystal ball. When this happens, the government will consider relaxing the barriers, because now the land lease set out the use of the site. As mentioned, you can apply for a waiver to change the purpose of the site. We note Ms. Kong's suggestion. We'll look into it when we conduct our review. Thank you. Next, Ms. Judy Chan. Thank you, Chairman. The government is about reform, seeking changes. The government will only conduct a review in 2026. This scheme is so well intended. Given our aging population, it seems that the speed of review cannot catch up with the speed of aging of our people. So should we not be more proactive and aggressive? The property market is not good currently. Have we tried to promote the scheme to the developers? That's my first question. Second, I'd like to ask about the direction of the scheme. Policies and legislations need to keep up with the times. Now, this scheme has been implemented for some 20 years. Previously, we didn't have a Greater Bay Area retirement scheme. We didn't have aging in place scheme. Now we have these two schemes. Do you have a KPI for this particular incentive scheme? How many places do you want to have? And what is your next step? That's what I'd like to hear about. Thank you. Deputy Secretary. Thank you, Chairman. Thank you, Ms. Chan. Under the scheme, when the departments receive land lease applications, planning applications, they try to promote the scheme to the developers. So since the enhancement measures been rolled out, we have received more applications. In a year and a half time, we're going to conduct a review to see how we can improve the scheme. When necessary, we will step up publicity to promote it to more developers. But as I've mentioned, developers are business-oriented. Some of the applications are pure RCHE premises projects. Some of them are mixed-use development projects. That's the decision of the developers. Second question on KPI. Ms. Chan asked if we do have a goal. Well, this is a business and market-oriented scheme. The government's role is a facilitator, promoter. We offer policy incentives to encourage developers to apply for the scheme. As to whether or not the developers apply for it is their decision. So we don't have a KPI under the scheme. For us, the more applications, the better. But that does not mean that we don't have any KPI in other areas. Under this term of the government, we do have 6,900 subsidized places for RCHE and RCHDs. We also have a KPI of 900 community care places. These are the KPIs of this terms of the government. Thank you. There are still 2 members waiting to speak. If necessary, I may extend the meeting by 15 minutes. Mr. Michael Tian. Thank you, Chairman. Everyone is talking about KPI today. The Chief Executive has a clear KPI on the waiting time for PRH units. And everyone is working towards the goal. The scheme was launched in 2003. The first project was completed in 2021, and the application was made in 2008. The second project was launched in 2024, And the third one was applied in 2018. Even if it's completed within this year, it took some 7 years. I don't think that you know if the project will be completed within this year. I mean, the project that has its application submitted in 2018. Chairman, can I start answering Mr. Tian's question? Do you want him to answer your question? That's a quick question for you. When will this 2018 project be completed? I will ask my colleague to talk about the progress of individual projects. Never mind. You can give me the answer in your reply later on. You said that you used to have 8 and now you have 10. Minus 2, you have 16 projects. Please give us your goal with these 16 projects. What is the progress? Are they under land exchange process? That's the first thing that I want to see from you. Because if you don't have the information, what's the point about this meeting? You only said that you would do your best. That's meaningless. That's not how the chief executive works. They always have a KPI. I hope that you will give us a KPI on this incentive scheme through various enhancement measures. How much time can be shortened from application to completion? It could be 5 years, 4 years, 3 years. It would definitely not be 1 to 2 years. Now, with this ultimate goal, then we can check your work against it. Thank you. That's something for you to think about after the meeting. Second, before the launch of the enhancement measures, you have 8 applications. After it, you have 10 applications. It seems that there is improvement, but that's not good enough. I know some developers. They said that in the land exchange programs, with the enhancement measures, there is an exemption of calculation of total GFA. They are not forced to provide any RCHE premises in their developments. The only incentives is that they have premium payment exemption, they have GFA exemption. They'd rather not go through the hassle. They don't think that the 2 exemptions will allow them to profit more. The people may think that the property or developments with RCHE could be sold at a higher price, but that's not the case in reality. Will you offer them some reverse incentives? That is, apart from giving them GFA exemption, offering also premium payment exemption per bed places. In that case, the developers would be incentivized to offer more RCHE places because they can save on land premium. I asked you to talk to the developers. The developers said that you've never talked to them. You never asked them what they want. And I trust them for it.
Thank you, Mr. Michael Tin, for your views. When we take stock of the scheme, we'll consider what Mr. Michael Tin has said just now. Well, above all, you need to know what developers want the most. Yes, indeed, how to make the scheme appealing. Yes, your scheme isn't appealing at all. We have 16 applications at present. We've seen an increase in the past half a year. So do we need to provide more sweeteners, to provide more incentives? Yes, we'll consider that. Well, can you provide us with a written reply in relation to your ultimate goal? Well, in our answer to Mr. Chao Siu Chung's question, our departments do have a goal in relation to the time when the applications need to be completed. In handling the first application, it was submitted in 2008 and approved in 2012. The project proponent kept amending the design. That's exactly why the application took 4 years. The developer then went to apply for a license on the residential care home. It took 8 years. Well, the second application waited for 10 years. Well, we can offer an explanation as well. We need to go to the construction site to have a good understanding of the projects. The other project, 2014, applied. 2016, the land lease was approved. It was a combined development. Residential care home, no premium, whereas for the residential developments upstairs, there needs to be a premium. So I believe this time is actually quite short. It's quite efficient. In 2023 to 2024, they came to the SWD to apply for the license, and within half a year, in September, the license was approved already. Construction, commission, all these are in the hands of the developer, not the administration. Well, is there any way for you to call shots? Well, we'll have to have regard to the market situation. Well, Chairman, I'm simply explaining the situation to members. That's how the market operates. All right, so the administration will continue to take the market-oriented approach. The market is already expediting the progress. We need a solution anyway. Well, just now you already told them to discuss with developers. I agree with you, Mr. Michael Tin. Developers told me as well. The administration would stifle the sales of flats when there is a residential care home in the development. When we can resolve the problem in relation to incentives of developers, of course, then we can improve the situation. Some developers are in two minds about whether to go with the development or not. Well, what you said is correct. Just a premium alone wouldn't make the project appealing. Well, please discuss with developers. We need to enhance efficiency as well as quantity. DS. The positioning and the design are determined by the developers. The piece of land belongs to the developer. Next, Mr. Ambrose Lam. Thank you, Chairman, for extending the meeting so that I can ask my questions. Some 300 flats towards the end of this year. About 3,000 flats. We have an aging population in Hong Kong. It's getting more and more serious. If there aren't sufficient flats, so what will elderly people do? They will seek to modify the flats, and it takes some $1 million to readapt their flats. The smaller the flats, the safer for them. But they do need a space to take a rest. If they can secure a smaller flat, and the design is suitable for elderly people, I believe they don't mind selling the old flat before securing the new flat. There's a lot of demand in society. So why aren't there a lot of private developers to take part in the project? I agree with the administration. It's due to the lack of incentives. As far as I understand, 12,000 GFA for exemption of premium, that includes open space as well. The plot ratio isn't the best yet. The Lands Department, the SWD, should discuss with private developers, as Mr. Michael Tin suggested. Even if there's a demand in society, if the project isn't that profitable, private developers won't be interested in developing or starting a project with residential care homes either. There are a lot of vacant shopping malls in Hong Kong. There are a lot of vacant stores in these shopping malls. Will you contact private developers? Will you provide incentives so that they will turn these shopping malls into residential care homes? I believe there's a demand in society, and the administration needs to think about this. DS. Thank you, Mr. Ambrose Lam, for your questions. 12,000 exemption of gross floor area. Public places aren't included. We just count residential care homes area. 3 years from now on, that is 2026, when we conduct a review, we will see how we can enhance the incentive to incentivize even more private developers. For existing shopping malls or residential blocks, many restaurants have folded. Some premises have been led by residential care homes. Many transactions in the property market are those in relation to residential care homes. They do need a large space. The rents are more stable. In older buildings or commercial developments, there are a lot of new residential care homes or residential care homes which have their leases renewed. We want to have more residential care homes. From the policy perspective, we will incentivize more residential care homes to be put to service. I'd like to see clarifications for the 12,000 GFA that includes open space. What about recreation room, snooker room, mahjong room? Will you provide more incentives? Well, within the residential care homes, 12,000 GFA exempt. But then for public place, for open spaces, they aren't exempted. Is that correct? So you mean in addition to the 12,000 square feet or square meter, will other spaces be exempted as well? $12,000 square meter GFA facilities about elderly people, they are covered. If the development is large enough, if the project is 500,000, 10%, which means $50,000. We'll take the greater one. Well, for the maximum of 12,000 GFA, many projects haven't used the entire 12,000 square meters. They haven't yet used up the maximum gross floor area. So even if we are to further increase it, that will not enhance incentive either. All right, that's the end of this discussion item. AOB, the panel is going to visit Siu Lam Integrated Rehabilitation Services Complex together with the subcommittee on issues relating to the support for PWDs. The complex is co-run by the SAHK, Tonghua Groups, and the New Life Psychiatric Rehabilitation Association. Details will be announced in due course. Do members agree to invite non-members of the panel to join this activity? Yes, members agree. There's no any other business. Meeting adjourned. Thank you, members.